Who do we have on the line from Region 9?
Hi, this is Sarah Park from Hawaii Department of Health.
Hi. Anybody else from Region 9? How about Region 8?
Hi, this is Dean Penovich from Utah.
Hi. Welcome.
Thank you.
Anybody else from Region 8? How about Region 7?
Hi, it's
This
Bruce
is
Clemens from Texas.
Melissa Friel with State Emergency Management Agency.
I'm sorry, could you say that one more time, Melissa?
State Emergency Management Agency.
From which state?
Missouri. Did I not say Missouri? It's Monday here. Okay, we had an eclipse yesterday.
Yeah, it was eclipsing yesterday. I also heard another voice. Who else is there?
This is Wynn from Illinois.
Hello.
How are you?
Doing
Sorry
well.
I'm joining a little late.
Anybody else from Region 7?
This is Michael McNulty from Kansas.
All righty. How about Region 6?
Hi, this is Bruce Clemens from Texas. I started to speak up before because I'm multitasking. So.
All right, well, welcome. Glad you could join us.
Hi, this is Margaret Starks Robinson from Louisiana.
Wonderful. Thank you for joining.
Yeah, this is Phil Maytubby from Oklahoma City.
Wonderful. Good representation from that region. How about Region 5? We already know we have one from Illinois.
Yeah, Wynn's from Illinois. Thank you.
This is Jackie Scott from Michigan.
Wonderful.
Yeah, hi, Linda Scott from Michigan is on as well.
And this is Claudine McCarthy from Wisconsin.
Anybody else? Region 5. Region 4. Shy region, or mysteriously nobody on? Okay, we'll move to Region 3. Anybody on Region 4 speak up later? Region 3.
This is Jennifer Martin from Baltimore City.
Wonderful. Region 2.
This is Rachel Santa Maria Schwartz from New York City.
Wonderful.
Mike Primo, New York State.
Region 2, Region 1.
Denise Kroll from New Hampshire.
Rhode Island.
Hello. Just the whole state of Rhode Island?
This is Denise Kroll from New Hampshire.
Oh, hi. No, I mean, whose name was that? Who else? Who's the person from Rhode Island?
Oh, sorry.
It's okay.
Okay.
This is Rhode Island, Miss Mahalis and Mr. Sheridan.
Hi. Thanks for joining. All right. Anybody else that we missed on the top from the...
Hi, everyone. This is Kara Stevens. I'm with Oak Ridge Associated University supporting CDC with PHEP program.
Wonderful.
This is Michael Lair in Washington State.
Hello again. Okay. Well, thanks, everyone, for doing that. Just another reminder real quick that we're recording this, so if your colleagues or somebody you know is missing or not able to attend, we can get this posted. So we'll figure that out and send it out to the list. We'll have Regina and Katie help with that. So before we kind of jump into the training, I wanted to see, is Katie Dwyer on the line from NACCHO?
Yes, I'm here.
Hi, Katie. If you could just give us the quick background on what brought us all together and the culmination of how we ended up here at this training, that would be great, since both Eli and I are rather new to this process, so we could just make sure we're all kind of in the same place and then move forward on the training.
Sure, thanks. So hi everyone, this is Katie Dwyer. I'm a director on the preparedness team here at NACCHO. It's nice to hear some familiar names on the phone. I think a lot of people are fairly familiar with the genesis of the project, so I'll be brief, but just to make sure, as Carolyn said, we're all kind of on the same page. Excuse me. So the PHEP Impact Project, as we're calling it, sort of launched or kicked off, or its predecessor, in May 2015. And the goal of it was really to increase awareness of the PHEP program and its impact on the long-term sustainability of the program and what impact it has on health and safety in our communities. So the goal was really to just improve awareness of the PHEP program and how its importance for state and local public health. So out of that, ASTHO actually developed, working with CDC, a communications toolkit. That toolkit is available online at PHEPimpacts.com, and it included a series of templates for success stories, talking points, other key messages. It's really sort of almost like a resource manual or a guide, a reference guide of sorts. And then from there, I think the CDC, ASTHO and NACCHO, as well as many of you who are on the phone, sort of got together and said, okay, now we have this great resource. What are the next steps? What can we really do to build on it and to put it into practice to impact change? And so in December 2016, the PHEP Impact Steering Committee was formed. The co-chairs of that committee are Chris Cosmos from CDC and Marissa Raphael from New York City. And membership includes representatives from NACCHO, ASTHO, CDC, as well as several state and local public health representatives. And really, the PHEP Impact Steering Committee is kind of a project management function of sorts, and it dedicates resources and time to this project. So the main things are, the main objectives of the group are to prioritize work activities, ensure collaboration across partners and work groups, and to provide general guidance and direction to the two work groups that are comprised under it, which includes the communications work group and the policy and partnership work group. And I heard several folks on the phone who are members of those work groups, so I won't go into any great detail about them, although please pipe up if you'd like to say something else about them. But essentially, the comms work group to date has been doing a lot of work on creating the PHEP Impacts one-pager along with several other folks, and has been conducting outreach to share that template to try to encourage individual other state and local health departments to develop their own one-pager templates. And I'm sure we'll be talking a little bit more about that template today, but it's just a great resource, kind of a one-pager about the PHEP program, and then provides an opportunity for you to include specifics about your jurisdiction or state on sort of the other side. And then the Policy and Partnerships Work Group, their charge was to sort of identify the top policy issues that the group wanted to work on, and they identified those as sustaining funding for the PHEP program and also the response fund. And so then the next sort of charge for that group was to identify who would be the appropriate people at the state and local level to help sort of carry those messages to policymakers and the administration. And so in March, both ASTHO and NACCHO, in coordination with the PHEP Impact Steering Committee sent out a request to our respective memberships to identify individuals who could serve as spokespersons. And so I believe that many of you indicated, or others in your health departments indicated, that you were willing and able to serve as spokespersons in some capacity, whether that be traveling to D.C. or be doing something in your home state. So that's kind of where it brings us to today. I'll just mention that in parallel with this, of course, ASTHO and NACCHO's government affairs groups have been doing a lot of advocacy activities and educating policymakers on PHEP in coordination with all of the other public health priorities and programs that are important to our membership. So both groups have done Hill Days. They've been meeting with members on the Hill and organizing meetings with state and local representatives to meet with members and their staff. I know from NACCHO's perspective, we send out a lot of action alerts and information to our membership, just sort of about what's going on the Hill. And I'm sure there's lots of other things that I've forgotten, so Carolyn and Eli, please feel free to jump in there. And I think that kind of just sort of summarizes where we are today, but I know that there's other folks on the phone who are members of the steering committee and who have been involved in this process, so feel free to let me know or share anything else that I might have missed.
Great. Thank you so much, Katie. Does anybody want to add anything to that before we jump into the training? Nice job, Katie. Nobody has anything to add. So I'd like to kick it over to Eli Briggs, who's from NACCHO, to provide us just a little bit of background and overarching environmental background and the opportunities that are available at this moment, kind of at this point in time, and just kind of provide a little bit of the landscape for you all to fit in the training on the more focused training on our toolkits that we have. So Eli, if you want to jump in and provide that background, that would be great.
Okay, great. Thanks, Carolyn. And I'm just trying to, bear with me. Carolyn tried to share with me the conference controls so I can show you my screen, which I'm trying to do right now. Okay, so it looks like I can now share my screen, which I'm going to share. You should be seeing,
something's loading up.
Okay.
And it's a dark screen. There we go. I see the appropriations process page.
Okay, great. So this is just a backdrop that I'll talk a little bit about, but we wanted to give you a little bit of sort of an overview of what we are anticipating coming up in the fall with regard to appropriations, because I know that this group has been very interested in communicating more about, obviously the impact of the PHEP program, and doing that in a way that's going to be beneficial to and relevant as far as the appropriations process is concerned. So for the fiscal year 18, which is the next fiscal year that starts October 1st, so I think folks may already be aware that the House Appropriations Committee has marked up their bill and included an increase for PHEP, and the Senate is anticipated to come back in September, right after Labor Day. They're going to be marking up their bill. So, and then we get to see what the Senate includes whether they're going to include the same amount of funding for PHEP that they included in 17, or whether they're going to go along with the House and include an increase. And then also there is this question out there about since the President requested in the President's budget a decrease for both PHEP and the Hospital Preparedness Program, we're kind of have been really pushing hard against that idea that PHEP and HPP are duplicative, and so we've been advocating for at least level funding or the same as FY17, if not an increase for both of those programs. And so the timing is such that this fall is really going to be critical. They are anticipated to need to pass a continuing resolution, and that's why I put this calendar up here on my screen, which is sort of the normal appropriations process. This is part of our advocacy toolkit that you should have gotten the link to when Carolyn sent out the meeting invitation. But so right now we are in the May to September block there, where you see House and Senate pass their spending bills. The differences between the two bills are worked out in a conference committee. That doesn't always happen. Sometimes it happens informally without a real conference committee. The leadership of the House and the Senate appropriations committees just sit down and figure out what they can both agree to. I do not think that's going to be completed by October 1st. I think pretty much everybody who's following this process thinks that there will be a continuing resolution to get us into the new fiscal year without a government shutdown. Probably that CR will be probably in the 2 to 3 month time frame, and that gives Congress a little more time to finish their work and to get appropriations completed. The one thing that makes things a little bit tricky is that we're living under budget constraints that are part of the Budget Control Act, which put in place spending caps or budget caps that we all have to live, all the appropriations bills have to fit under those budget caps. Now various people are talking for various reasons, some of which are more related to defense spending and things like the border wall that the President would like to see funded, are talking about busting those caps and actually passing legislation to allow Congress to pass bills that would go over the budget caps. But that all remains to be worked out, and it will not be worked out by October 1st. So what that means is that gives us a little bit more time and some new opportunities, or not new, but expanded opportunities to educate policymakers about what the programs do. And that's where the fact sheets that you all have been preparing that talk about the impact of the program are really going to be critical to educating folks about what the programs do, and the hospital preparedness and the PHEP program are not the same, and they serve different purposes and they complement each other. So I think that is a really important message. And so I guess what our message is that there is still time to really engage in this process, and that members of Congress, whether it's back home in your local communities where members of Congress have staff that are based in local communities, or whether it's if you have the opportunity to come to D.C. or to just send information electronically, we can help you with ways to get the information across. But I guess our message is that there will still be opportunities to do that. So Carolyn, anything I missed or forgot to mention on that point?
No, I think you set the stage really well. I think just the other kind of little piece to include, but just adding a little bit of texture to what's going on in D.C. is the debt ceiling vote that will have to happen on September 29th, which is a little bit interesting on that timing when that has to happen. So there's just a handful of legislative days left before the fiscal year ends. So I think Eli's point about there being a little bit more time to really work into some of the impacts of the programs and the funding is solid. So just keeping that in mind, that there's going to be a little bit more work to be done on this side of things before they can dig into working on the spending side. So that was just my other one little piece to add. So I wanted to now just jump into the toolkits and just kind of some framing here about the one that ASTHO has. They're very similar between ASTHO and NACCHO. We work closely. I wanted to just show you on my screen here the Senate schedule for legislative days so you could get an idea where your delegation members are on the Senate side. You can see if they're back home or if they're here in Washington, D.C. So be sure and take a look on the Senate. The House also
Carolyn,
has...
I don't think we're seeing your screen.
Okay. See, I have two screens, so I'm not sure how this works. Let me move everything over here, and maybe that'll help. Thank you, Eli, for letting me know. How about now?
Yes, now we can see it.
So basic. It just all has to be on the right screen. Sorry about this. So just wanted to encourage you all to check the schedule so that you know where your members are. There's a House of Representatives calendar as well put out by the House Majority Leader, so you can see where they are in the time slots that you're thinking of. Here's the PHEP Impacts website that Katie was talking about. You all probably know about this, but just wanted to highlight that, and it's beautiful. So jumping into the training section, we framed hours here at ASTHO for meeting with your delegation at home, but this is all applicable to meeting with your delegation here in Washington as well. So just to kind of take these as a general overview for how to think about meeting with your policymakers. So we have an introduction from our fearless leader here, Mike Fraser. There's some background. Eli provided a good overview, and you all are highly motivated already, so I'm just going to kind of move through this section. I wanted to really highlight this page that we have to let you know that there are some levels of engagement that we try to suss out here, where we have education, advocacy, and lobbying. And there's some differences there, and education being how we think of it, and Eli, feel free to jump in, is really just more description of a program, research analysis, just overall general speaking about a program or public health preparedness. Advocacy is communicating with policymakers and general public about specific issues, and more taking a position and conveying a value about your position. And then lobbying is very much more specific and direct, which I don't think you all will really be doing, but just wanting to lay these out here, where lobbying is more talking about very specific legislation or regulations or funding amounts. So take a look at that and just align your rules in the state or local health department with what you're able to do and how you thread that needle. And those vary. So we just wanted to lay that out there for you all. So we talk about the recess and the district work periods. The one benefit, or a major benefit about doing a meeting with your delegation at home is that you can invite them to your local health department. Everybody loves photo ops. There's a lot of really cool things that they can tour in a local health department. Public health laboratories are especially interesting. You can show them the jars of interesting things that have been removed from people. And it's just really cool to kind of show them the return on investment of the federal funding that's out there, and the great work that you all are doing with the federal funding that you're doing. So just wanted to point that out. But if you're able to come to Washington, D.C., there's also benefits of coming here and meeting with your membership or your delegation here. So just kind of moving on through, this is, again, how to start from the beginning, thinking about when you want to schedule a meeting with your delegation, whether it be here in D.C. or at home. Your delegation has home offices. So if you're thinking about doing a visit in the home state or home district, they have schedulers that work there, so it might be beneficial to call directly to that office if you know that it's going to be a recess time, or if you're coming to D.C., then calling their D.C. office. And this page gives you some tips on how to do this and what to kind of include with your messaging when you're calling to set up some time. So following up with the scheduler, once you've set a time, thinking about the date for the meeting and discussing what you want to include in your visit if you're inviting them to your health department is all very helpful to do. We have some sample email invitations here that, sorry, I should have turned off my Skype. When I started this. So the sample email invitation, we make this all pretty easy for you. And then we have some sample email invitation for a meeting at your state health department or your local health department. We also included a sample health department visit. You feel free to move this all around and to highlight different programs, meet with different folks. This is more of a general health department visit, but if you within want to break out your health department visit to different planning and response pieces for your public health preparedness activities, think through that. Maybe if you have some SNS preparations or materials that you want to show, that's always pretty cool. So just think through what you would want to include in a health department visit. This piece, the fact sheets, you all are very well prepared for this. It's great to kind of think through what you want to provide your delegation, either in D.C. or if they come to your health department. If you're still lacking in these materials, ASTHO and NACCHO staff are available to help you pull those together. They have access to data and impact information for most states and localities. So please just get in touch with us if you want help pulling these together. We have templates. So it's really great to have something that your member or their staff can hold on to jog their memory when it comes time to when they're writing and working on appropriations legislation. And you all are doing great work. So keep that in mind to have some information ready and simple one-pagers, nothing too in-depth, to help them just refer back to what y'all talked about. There's also some sample talking points that we've included here. Again, really what you all have been working on, so I won't belabor the point of this, but you all are really teed up well to provide this information to your delegation. So feel confident that you have this all together. But this toolkit really helps you think through the pieces of what you want to bring to a meeting or have somebody bring or receive when they come for a visit. Here's some more real talking points that you can use just as an example. These are very general public health talking points, but again, feel free to tailor these sorts of things to your messaging that you're trying to guide for your impact in your state work or local public health work. And then as a reminder, like any good meeting with somebody, be sure and provide follow-up if they've asked you for more information or details. Follow up and provide that information. Always thank them for their time. Just to remember and be sure and send those pictures or tag them in social media. We all know how widely those messages can spread, and positive reinforcement for strong programs goes a long way. And delegations really like to show their engagement with the communities. So here's some cute pictures. And then this is the ASTHO fact sheet. It aligns highly with the NACCHO fact sheet on federal funding recommendations. So you have this at your fingertips. If you want to turn this into something on your fact sheet, feel free to take a snapshot of this and drop it on a document. So you'll see the Preventive Health and Health Services Block Grant. You'll see the HPP and PHEP programs, as well as some Zika response that we have in here for just recent Zika efforts that have needed some funding, some emergency funding. And then below we have deeper dives into each one of those programs. So Eli, I'll let you jump in if you want to add something or scroll through anything that you want to highlight from your toolkit. I've brought yours up to the screen.
Okay, thanks, Carolyn. So I'm not going to walk through NACCHO's toolkit because it's very similar, and like Carolyn said, we do collaborate a lot and share information. So just feel free to peruse them at your leisure. The one thing I will just note is that in the NACCHO toolkit we have, similar to ASTHO, we have a link to some suggested talking points, but obviously feel free to make those your own. And also we have a link to more of a general fact sheet that we suggest people use to talk about the work of their health department overall, but obviously you all have already, some of you have already made fact sheets around the preparedness activities, which is also really great and a good visual and a good way to organize your information. So I think our purpose today was just really to give a little bit of background and how we would suggest, going about this process of, educating policymakers and how we, some tips that we thought might be useful. I think at this point we don't have too much more to say other than to, open it up for questions and comments from anyone, and to really let you know that we are a resource. I know Katie and Regina and others on our program side of things maybe have been more engaged with this group, but we want you to know that Government Affairs is also engaged, and we're here for you. And because of the regulations around using federal funding for anything approaching lobbying, we really need to keep that separate. And so we want you to know that we are here for you, and feel free to engage with government affairs separately and directly. Don't feel like you have to go through one of our other colleagues, because we're here to help. So, Carolyn, anything you wanted to add, or should we see if folks have questions or comments they want to provide?
Nothing on my side. I'd love to hear if there's any questions, and then if people have pending plans or thoughts about who they want to meet with. We have about 5 minutes, 10 minutes, so let's open up the floor.
Hi, this is Alicia Mahalakas in Rhode Island. Thank you for an impressive package. We really appreciate it. I just wanted to touch base that after the meeting in Atlanta, the Preparedness Summit, the conversations that we had there, I did have an opportunity to brief all of the staffers from the entire congressional delegation in Rhode Island. So a lot of these points, we tried to hammer home early, not knowing, what turns were going to come next with the budget, but we're certainly open to additional opportunities to speak to specific individuals. I know Senator Langevin is on the House Appropriations Committee, and that was a particular pickup by the committee overall to, as a specific person we wanted to target. I did speak with someone from his office, but not with him on that day specifically. I have spoken to him since, but primarily about his concerns for cyber. But again, depending on how we want to move forward, or if there are specific concerns, I'm happy to continue to address them here.
This is Carolyn from ASTHO. That reminded me of a certain point too, that we would love to hear back with to hear the feedback of meetings or any contacts that you've had, just so that we can reinforce the message or reiterate or echo what you all are talking about on the Hill, or with your congressional delegation in your home state or locality. So please feel free to loop back with us, even if we're not involved with scheduling or planning. Just loop back so that we can coordinate and make sure that we're reinforcing your message or echoing and just looking coordinated. Thank you so much for letting us know, and great work on reaching out.
Hey, Eli or Carolyn, do you know who on the Senate side is going to be marking up the appropriations bill that covers PHEP and all the others?
Yes, the Senate bill will be marked up starting, but with the Labor, Health, and Human Services Appropriations Subcommittee. So that subcommittee is chaired by Senator Blunt from Missouri, and the ranking member is Senator Murray from from Washington. My local bias is showing. So the subcommittee members will first consider the bill, and assuming that it moves forward out of subcommittee, it will go to the full Appropriations Committee, which is chaired by Senator Cochran of Mississippi and Senator Leahy of Vermont. So those will be the relevant players. I didn't mention everybody on the committees, but if a quick Google or going to www.senate.gov, you can find all the members of the subcommittee and the committee.
Thank you.
And just a timing note, the markup is scheduled for the first week of September, after they get back from Labor Day.
Any speculation on when that'll go to conference committee?
Well, let's see. Then we get, after the committees have done their work, then they're going to need to raise the debt ceiling, like Carolyn was saying, and pass a continuing resolution. I don't think anything is going to happen. I don't think a final bill will be passed by the end of September. So they will need a continuing resolution to keep the government open, and then like I was saying before, negotiations are going to need to happen around raising the budget caps if they want to do all of the things that they've talked about doing. So it could be another 2 to 3 months after. We may not have an official conference committee. It may be just a sort of a sitting down and figuring out what both sides can agree to. There are some requirements about things being done in public when you have a conference committee. So often they just sit down and work things out. Unfortunately or fortunately, things don't happen always the way it's outlined in the how things are supposed to happen. So I think we're looking at, usually, Congress needs a deadline to force them to do things. So I think the Christmas holidays in December are going to be that deadline, and so we'll probably see something by the end of the year.
Okay, thank you.
So I know we covered a lot of ground here on the call, and it can be quite an involved process, but not daunting. So please feel free to reach out to Eli or myself. We put our contact information in the meeting invite, so we can help anytime, and would love to hear back that y'all are meeting or have things set up, or if you need help planning. We're here to help, so please just let us know. Did anybody else have any final thoughts before we wrap up and let you get back to your days? Eli, do you have any final thoughts?
Just thanks everyone for joining.
Yeah, thank you all so much. We had really good turnout. We had about 27 at the max. So really great interest. I'm really happy to see that. And we'll work on getting this posted for your colleagues who weren't able to join. Thanks everyone.
Thanks for all your work.